So, a 31-year-old homeless and uninsured man is brought to the emergency department because he was found agitated and yelling for help. He is well known to the emergency department and has been in and out of the hospital 6 times in the past month for various issues. He has used up his allotted healthcare assistance program limit and has an outstanding debt to the hospital. When the physician speaks to him, the man states that he just used some drugs that his friend gave him and now has chest pain. Except for illicit drug use, his past medical history is unknown. He appears unkempt. He is diaphoretic, malodorous, but oriented to time, place, and person. Which of the following is the most appropriate statement by the physician? Your options: we will need to set up health insurance coverage for you with the county healthcare assistance program before treating you. We will treat you to the best of our ability, but we will not be liable in the event of medical negligence. We will check your vital signs and do a workup for your chest pain, but we will have to deny further treatment if the cause of your chest pain is not a medical emergency. We will help you get transferred to the nearest hospital, but we cannot treat you since you have used up your allotted healthcare assistance program limit at our hospital. We will treat you only if you commit to enrolling in a drug rehab program. Okay, so here we have a homeless and uninsured man who came to the emergency agitated and yelling for help. So first of all, he came to the emergency room. Okay, it is mandatory in the emergency room for them to stabilize the patient, whoever comes there. Doesn't matter if he is a homeless or if he's uninsured, basically. He has been known to the emergency, so he has been there. He probably knows people, and he has been in and out of the hospital 6 times in the past month, right? And he says that he has chest pain, right? Now, chest pain is something concerning. Apart from him being homeless, agitated, and uninsured, and whatever he's going through, chest pain is something concerning. So whoever comes to the emergency room, it is mandatory to stabilize them and to make sure that there is no emergency in medical treatment that needs to be done at that point. Okay, that's why we are right in this answer that we will check the vital signs and do a workup for chest pain, but we will have to deny further treatment if the chest pain is not a medical emergency. Denying doesn't mean you're just going to let him go. You're going to let him go with some recommendations, maybe recommendations for social workers, for homeless shelters, for a rehab center. There are certain things that you can do for a patient even if he is uninsured. You can actually recommend or advise at least, but make sure he's stabilized. That is all. Okay, other options such as we will set up a health insurance coverage for you and then we will treat you, so that doesn't make sense. First of all, you have to stabilize a patient's emergency situation, and then you can advise him on the health insurance and everything that you want to do for that patient. We will treat you to the best of our ability, but we will not be liable in the event of medical negligence. You will be liable for medical negligence if that happens. Okay, so even if you treat an emergency situation and if something goes wrong, you will be the one responsible. All right, we'll help you get transferred to the nearest hospital, but we cannot treat you since you have used up your allotted healthcare assistance program limit. Doesn't make sense. If the hospital doesn't have a emergency room and you cannot do that emergency workup, then you will have to transfer this patient. Otherwise, you do not transfer, you stabilize the patient, and then you ask him for any assistance program, whatever you want to do for that patient. We will treat you only if you commit to enrolling in a drug rehab program. It's not necessary. Okay, not everyone is gonna participate in a drug rehab program, and that's not even a criteria to treat someone's emergency condition, right? It doesn't make sense in itself. So we have to stabilize anyone who comes to the emergency room. We have to stabilize emergency medical conditions, and then we can deny further treatment if it's not an emergency. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.